So another symptoms associated with the fever, the rashes. So most commonly, if anybody having like a severe infections or any inflammations or because of the any other disease progressions, this is going to be the side effects or maybe is associated with the high fever. So these are the eruptions occurring over the skin, mucous membrane is may of them are associated with the fevers. So rashes are associated with the fever in many conditions. So if anybody get the fever with the rashes, so this is the that means diagnostic procedure is very important. So this rash maybe is a macular, papular, vesicular, and also the pustular, hemorrhagic, and also this is going to be different type of the rashes. So where we are going to sometimes there which looks like the bleeding and also papule like or vesicle type, or some things are the, like a fluid is going to be inside the like a rashes. So we can find different type of the rashes in the different type of the conditions. So this fever is characterized by occurrence of the rashes over the skin are called as the eczematous fever. So if any fever associated with the rashes, so that is called as xanthomatous fever. So this is called as xanthomatous fever. If the rashes occurs in the mucous membrane, is called as the is anthemas. So anthemas is going to be the, if any in the mucous membrane. So the distribution of the rashes and the time of their appearance are is a different characteristics. So when they're going to, how the distribution is going to get and what the other characteristics of the skin rashes. So if you see here, the first day of the fever, so it indicates if anybody fever and also rashes occurs, the first day itself, so we can get the clue. So it is maybe because of the chicken pox. Second day of the fever, so is a scarlet fever. So if because of the some insects bites, so this may chance to get the sore throat and also along with the fever and rashes in the second day is commonly seen in the scarlet fevers. And as next one, third day, if it is the small is going to be appearance of the rash on third day, it is called as smallpox. But most probably nowadays is the smallpox is not available. It's already eradicated. So I think no, most of the countries are there is no smallpox now. After we got the advanced vaccinations, so there is no smallpox until now. But if anybody get the rashes, previously the clinicians has to found that this the third day rashes are indicating the smallpox. If anybody get the fourth day, rashes are indicates the measles. And fifth day is going to be the typhus. Sixth day will be the typhoid. And also is usually yes, like a red spots is commonly seen in the typhoid. The appearance is going to be a little bit different. And also is going to be is early administration of the antipyretics and other drugs alter the natural history of the disease. So that is the reason. If anything causative factor, if they are having high fever, high temperature, the first main foremost important thing is we have to give the antipyretic medications, such as like a paracetamol. And also next one is the rashes may also be due to adverse reaction of the drugs. Sometimes, if for example, fifth day or sixth day, if they get any rashes, we have to think about the typhoid, or otherwise we have to think about the any like a what is the treatment plan which he got. That means in the initial day, first day to until the fifth day, what medications he got. Sometimes these medications also may use the side effects which produce the like a rashes. So here I'm going to give some different type of the rashes so we can easily rule out the what are the different type like in which conditions. So for example, is a Koplik spots. So these are going to be the bluish gray spots occurring inside the cheek, opposite to the upper second molar. So this is going to be the commonly seen in the diagnostic. So if you see here, is going to be the like a grayish spots inside the cheeks. So inside the cheeks, if you open the cheeks, so we are going to found so this type of the spots. And also these are very important. And also is the next one is the maculopapular rash. So it's over the butterfly area of the face is highly suggestive of the systemic lupus erythematosus. So you can see here like a butterfly appearance is going to be the butterfly appearance area. So it's going to be, so it may appear on the chest or back, so all the places. And this is an indication of the systemic lupus erythematosus. So the fever is there and also butterfly appearance. So it indicates the systemic lupus erythematosus condition. And also next one is the erythema marginatum in the rheumatic fever. In case of rheumatic fever, so it's a coppery rash in secondary, in commonly seen in the secondary syphilis, hemorrhagic rash commonly seen in the meningioma. So if it is the appearance like this hemorrhagic one, we can commonly see in the meningococcemia. So that means we are going to find the different infections produce the different type of the rash. So in case of erythema and also chromium margins, so this is going to be seen in the Lyme's diseases are only few of the many examples. So we can find the different rashes in the different conditions.